the elderly, administrative orders can be put in place by the operators to require visitors and persons on the premises to wear a mask in order to minimize the risk. Secretary will now give you details on the decision and the justifications. Secretary. Thank you, Chief Executive. As the Chief Executive has just announced, starting tomorrow, the 1st of March, the mask mandate applicable to all premises, including outdoor, indoor premises, and public transport, will be removed. And I just want to add a number of points. First, the mask mandate is to be lifted because we're keeping COVID-19 at bay. According to statistics, be it sewage surveillance, the number of hospital admissions, of serious cases and fatalities have been kept at a low level. And we haven't seen a surge in the number of influenza cases. And in high-risk places such as schools, hospitals, residential care homes, we have not registered any major outbreak. Second, although the traditional winter surge and the upper respiratory tract infections have not come to an end, and we do envisage a slight increase in the number of cases. It will be transient, and in the long run, the risks posed to high-risk places such as hospitals and care homes will be kept to a minimum. Third, as mentioned by the Chief Executive, although we are lifting the mask mandate in order to protect the high-risk groups, the government will put in place administrative arrangements to require those visiting high-risk places to continue to wear a mask. For residential care home staff and visitors, they should keep their mask on whilst inside these premises. The Center for Health Protection will also issue a health reminder for those with upper respiratory tract infection symptoms. For more vulnerable groups, they should keep their mask on when they are in places with poor ventilation. Point number 4, we're lifting the mask mandate altogether instead of disapplying the mandate on just some premises because of the limited use of masks in relation to preventing the epidemic. Not to mention that wearing of masks may be inconvenient for some. Hence, we've decided to lift the mask mandate altogether. Since the middle of last year, we have been taking orderly and progressive steps to help Hong Kong tide over the COVID-19 pandemic and return to normalcy. With lifting of the mask mandate, we've now officially removed all anti-epidemic restrictions. And we look forward to a better tomorrow, and that is the 1st of March, so that we can all put a smile on our faces and say, hello, Hong Kong. Finally, starting tomorrow, we will return to normalcy. So in this year and in the coming year, we'll place focus on economic development, and we will spare no effort in taking it forward to bring benefits to everyone in Hong Kong.
The floor is now open to questions. Please limit yourself to 2 questions. Before you put your questions, please identify your media outlet. First, the journalist in blue. I'm from TVB. Earlier, the mask mandate was extended to March 8th. Why decide to lift the mask mandate on March 1st? Are we just following others' examples? Are we already too slow in dropping our mask mandate? Have we already missed the opportunity to get tourists to come and creating a bad impression? For any decision we make, we have regard to Hong Kong's actual circumstances. We also base our decision on Hong Kong's best interest. 2 months ago, some raised this matter of mask mandate about dropping it. At that time, I said we would be watching the data closely, and when appropriate, we would actively consider this option. As I said just then, we have considered various factors. After taking all these factors into account, we consider this is the best timing to make this decision. As we're dropping the mask mandate, all the mega events, international events will come back to Hong Kong. Our economy will resume its vibrancy, and so will the same happen to all our social activities. Next question, on the right, the journalist in yellow.
JHK. So the first question is, why now is the right time to scrap the mask mandate, given that Macau have dropped its outdoor mask mandate? And the second question is about wearing masks at hospitals, care homes, and schools. Is that the remaining safeguards to protect people from COVID? Any elaboration on those policies? Thank you.
I have always told people that I will be monitoring the situation of Hong Kong in regard to the total number of infected cases, the overall trend, and the different data that indicate the situation of COVID in Hong Kong. And it is because of overall assessment of all the factors that have been taken into account, including those 5 factors that I've told you earlier, that I made the decision. And I have told people since almost 2 months ago that this is an issue that I will be actively monitoring to examine when will be appropriate time to lift the masking requirement. So after looking at all the data, the trend, and the fact that the winter surge is nearing the end, in order to give people a very clear message that Hong Kong is resuming normalcy, I think this is the right time to make the decision. And that is why today I make the announcement to lift the masking requirement as soon as possible, that is starting from tomorrow. And with the masking requirement removed, we are starting to resume to normalcy comprehensively, and that will be very beneficial to the economic development, international competitiveness, as well as our activities which involve everyone in Hong Kong. As regards other measures to ensure that we will continue to protect public health, we have also indicated that for premises or groups who will be regarded as high risk, then the person in charge of the place can still ask people to wear masks. We will continue also to monitor the situation, including some analysis of the imported cases, so as to ensure that the overall virus variation will be kept under control.
時間關係咧，我哋
We're almost out of time, so we will take the last question on the left, the journalist at the back. Good morning. Apart from the mask mandate, people are wondering what will happen to the isolation facilities. Before your visit to the Middle East, Chief Executive, you said you would ask your officials to look into other uses for the CIF. Yesterday, there was a meeting of a task force on the Northern Metropolis. Can we have an update? Second, on the mask mandate, people take off their masks. Then will we also scrap the prohibition of face covering regulation, or will that regulation stay? The Deputy Financial Secretary is taking a holistic view of the community isolation facilities in terms of what to do with them, on whether to keep some of them or what other uses these facilities should be put to. The Deputy Financial Secretary is actively taking forward the work. If there's any decision, we will make an announcement as soon as possible. Now, the mask mandate and the prohibition on face covering regulation are two separate matters. The mask mandate is about protecting public health, and the mask ban will be reviewed at an appropriate timing. Thank you. Thank you.